right, welcome. This is another episode of Dr. Dallas Unleashed.
Yes.
I am Dr. Dallas.
Welcome.
Wait, I got to introduce you guys first.
Okay.
Angelica's here with us. Hello.
Hey, hello.
And we have Amber here with us.
Hey guys, I kind of sound like a man.
Ew.
Yeah.
Sorry guys.
You were sick, right?
I was.
You're getting over something. By the way, you probably gave me something.
No,
Because I felt like caca with some doo-doo on top.
you were sick before
Thursday,
I
Friday.
was.
No. You were sick. You've been sick longer.
Yeah,
than I
I
have.
but
have
yours
been
got
sick
really
longer.
bad.
Yeah,
this
I was
week.
horrible. So were
Yeah.
you, but you're just more stronger than I am.
Well,
You
you
didn't
know,
have, like,
there's
pink
nothing that Advil, like 600 milligrams of
Yes.
Advil can't help that you take
Right.
like 3 times a day.
I was trying.
You kind of mask it. But there was one day, I think it was Thursday, that I was feeling the chills. You know,
Yes,
the actual
that's how I
chills.
was.
Yeah.
That I felt terrible. And even Advil kind of helped it a little bit, but I went home and just crashed.
That's how I was. Yeah, it was
Yeah.
bad.
It was long
I mean, when you get
days.
sick, Angelica, do you get sick bad or you have a pretty good immune system?
I think I have a pretty good immune system. Last time I was sick, I had the stomach flu, and it was awful. And that was like 2 years ago. It was when I was cheering for
Really?
like college nationals. I literally sprinted off the floor and threw up in a trash can.
Was
right
was it
after.
both ends? You were throwing up and then had a case of
just sick.
we call
My
it-
nalgas,
Nalgas,
right?
yeah.
Nalgas?
You-
no,
yeah.
that didn't hurt. I was okay.
Did you hear that Snapchat that I did the other day where I had a
No.
picture on Snapchat, a filter? I was
It was like a donkey.
a donkey.
He was an ass.
a burro.
Oh.
But then I said, actually, this was Saturday.
I have it.
And should we just save it and post
Should we
it?
say it? We're going to save it and post it, so
Okay.
stay
Yeah.
tuned.
Yeah, I haven't
Basically,
seen
I
it.
said I had too much Mexican food, and my nalgas hurt a lot the next day.
Nalgas, it's his butt?
But
Yes.
Hole?
yeah.
Or butt?
Well,
I guess. I don't know. I just Googled
Specifically, it was my booty hole that was
Oh.
on fire.
Yikes.
And too much Mexican food, too much salsa. Don't do it.
No, I
And then
love
you have
it.
to operate the next day.
Yeah, no, you can't do
Gotta
that.
wear a
'cause it's like
diaper
a
in the
rock.
operating
Oh
room.
my God.
It's like a rock in there.
Yeah, I got to
rock
foliate
food.
myself during the case, and I got to wear a
Foley's
diaper
a catheter, people.
so I can stay scrubbed in and just pee
Oh,
and
please
poop
stop.
without
Okay.
stopping.
Okay.
All right, so I wanted to tell you guys about a dream
Yes.
that I
Yes.
had the other day, and actually it was very recently. But I had a dream that, and I don't know who it was in the office, but I got these sort of illegal butt injections.
I love it.
It was so weird. So someone injected it, but they injected it in one spot.
Oh,
and
no,
They
you
just
get a lump.
jammed like all this stuff.
Yeah.
So literally there was a ball on my butt, and I kept looking in the mirror. The weird thing was it kept growing.
What?
Like it was
my God.
expanding. And then, but it was only expanding in like one area. So it looked like
Yeah.
this humongous zit on my
On
butt.
one butt cheek or both butt
no,
cheeks?
one butt cheek.
Oh, miserable.
And then it was really weird. And then it started to move around my butt. But it stayed like this
Ball.
circular ball that just kept moving, and it went all around my thigh. And then it finally burst open on the inside of my thigh, and it was just like this gross silicone weird. And I ended up pulling out myself, but it was just so scary.
Gross.
Yeah.
Wow.
But you hear about these illegal butt injections.
Yes.
Have you seen that stuff like on the internet?
I
And-
have.
Yeah.
I've
mean-
seen a lot of people like reach out to us about it too.
We do.
Like
We have a lot
black
of
market
people.
stuff, I think.
Right.
Sketch.
And you hear these things like
Yeah.
in New York.
Yes.
There was a
Yeah, you
nurse
do.
who was injecting, I think it was like illegal silicone, industrial grade
Like,
silicone.
are they going to like Home Depot and buying it?
You know, I think that's a caulking material that
Oh.
I've heard about
Yes.
that people have done.
inject that in their butt,
Like
though.
the
Yeah.
stuff you put it on like a wall and stuff?
Yeah.
Or what is it?
Yes.
Oh.
You know, like when you put tile, the
Yeah,
caulking
the caulk
stuff,
stuff,
the
that's
white
what I meant.
stuff. Yeah.
Not the wall.
No, not caulk.
Okay.
She's like the white stuff.
Yeah. Oh my
What?
goodness. No, not
No,
semen.
Oh my.
Semen injected into the boot. That sounds
Ew,
terrible,
That
doesn't
sounds
it?
so gross.
I mean,
Please stop.
If you think about it,
Cock,
technically,
do you know how to spell cock for your household stuff?
It's
Do you know
not
how to
the
spell
same?
that?
isn't it CAUK?
Close.
Something like that. You
Just missing a couple letters. Cock for your household goods, you know, when you're sealing off
Yes.
the edges, is CAULK.
oh caulk.
I think it's still pronounced the same.
Oh, it's still cock.
Right. Just like when you say
Okay.
she's fat, it's PHAT. Like
Right.
that's
Yes,
cool.
yes.
Versus fat, it's
like,
still
yeah.
PHF.
Yeah.
You Coke.
PHF. Oh, PH verse F.
pH, like fat.
Yeah, like there's like a chunky.
Yeah, and then
overweight
there's
person,
like the-
and then there's like that fat. You know, like thick.
Yeah, I don't know the cool
Well,
terms.
Like baby fat.
No,
You know
let's
what
talk
the-
about
I know what you mean.
PHAT.
I know what you mean.
There's a brand called Baby Fat. You guys remember that with the cat?
Yes.
Okay.
So,
TBT.
anyways,
Anywho, that was your dream.
Illegal
Okay. That's
butt
crazy.
injections. In the United States, it's illegal to use some of these off-grade silicone stuff. Can't do it. But so many people do it in the back alleys, whether it's in a hotel. I heard about one in Colombia. A newscaster wanted a bigger butt. So a very well-known plastic surgeon in Colombia, had this TV newscaster come to a hotel room.
Wow.
But he's this reputable guy. He normally does tummy tucks, fat transfers, but he was doing some other stuff. And, I think what happens is, all right, so you inject silicone, caulk, whatever. If it's under the skin, okay, fine, it might cause an infection.
But you can feel it all lumpy, right?
Yeah, it may be lumpy, and it can create granulomas where the body kind of attacks it and starts, gets red and inflammatory.
Yeah, not cute.
But I think when they're trying to inject it very deep, they're running into the same problems where it can go into your pulmonary vein and get like an embolus or something. And that's what is causing people to die. Otherwise, they're just getting really sick, or they have to go to the emergency room and get it debrided, just like a big bad infection.
Yeah.
But you just don't do it because it's so cheap when these people do it.
Yeah.
Right.
But anybody can go to the Home Depot and get caulk.
Yeah.
C-A-C-A-U-L-K.
That's why it's just better to do a fat transfer to your butt.
Anybody can go to the club and get some cock, right? But anybody can go to Home Depot and get coke.
Either way.
Either way, you're going to have a good
prefer.
time. No, she's joking.
Right.
He's Louise.
But so we
was your
get phone
dream.
calls, right?
Yeah, we do.
For that?
We
We
get
do.
tons of phone calls.
We do. We get a lot of them.
Yeah.
Reach
And
out.
so-
People wanting you to take out the silicone.
Yeah.
Yes.
And unfortunately, in my practice, I know some very good people that we end up referring them to. But if they're really sick, we don't see sick people in the office. It's not the appropriate setting. So that we do tell them to go to the hospital. And usually there are some doctors that we refer them to because it's a very, very difficult problem
To get out, too.
And, if something like that happens to anybody out there that's listening, you got to go to the emergency room.
Right.
And I don't know, is it easy enough to find somebody just by Googling, someone who can help me? You probably have to find a really good butt surgeon.
Yeah.
And then if that person wants to take it on.
Yes, that's the thing.
I think there are some people that would call and say, you're the sixth surgeon that's turned me down.
Yeah.
So it's kind of rare unless we know somebody to refer them to.
Right.
Yes.
No.
Yeah, I mean it's like someone has a rhinoplasty that's gone wrong and it's infected. We just refer them to
You
people
just go
who deal with revision type
Right.
stuff. Same with the butt. Even though we do a lot of butts, when it comes to those illegal stuff, since we're not putting it in, I guess we could remove it, but it's a whole different level.
Totally different ballgame.
Yeah, but don't do it. Don't silicone injections. It's just a problem. That's why implants are so great, because if you put in implants and there's an infection, you can take it out very,
Correct.
very easily.
Right.
It comes out just like a breast implant. But if you get that silicone and it's all in the fat and you can't take it out, you end up having to carve out good tissue just to get the bad tissue. And there's other people with lumps and bumps
Yes.
and
Ooh.
No.
you can just Google that and find some really
Right.
terrible stuff. So anyways, maybe I saw something and that's why I
Right.
had the
And
dream.
that was your dream.
Or did you eat something bad? Or maybe it's all that Advil?
It was around the time I had all that Mexican food over the weekend.
Yeah.
Do you
Well,
think
maybe.
too much
Did you take
salsa?
any NyQuil and you were having crazy dreams? I always have the craziest dreams.
Maybe when
I'm on
I've been
NyQuil.
sick because
Yeah.
I wasn't sleeping good, and when
Yes,
you kind of don't sleep
yes.
good, you remember your dreams better.
I just
Oh, I
have
didn't know
weird,
that.
crazy dreams.
Yeah.
Me too. I do too. I have some crazy.
Have you ever had a butt injected or
Not my butt injected, no.
no? Any other weird ass dreams?
It's like, not my
I've
butt.
had a lot of weird dreams, but
Nothing like that.
nothing
No.
like where a ball explodes in my
In my
leg.
thigh.
Yeah.
Right? And I'm removing it myself. All right.
I'm surprised I didn't have any penis, surgery or penis
Nightmares?
dreams, because we
Yeah.
talked about penis surgery
Yeah.
for like a whole hour
I
the other
know.
day. Yeah.
Yeah.
I still think it's crazy.
And still
The
I think
buried,
that's awesome.
the buried ones.
the buried penises.
Yeah, it's so sad.
yeah.
Little babies.
No, they're Google it.
Yeah.
Oh,
Google
no.
buried penis. That's usually a penis that's kind of almost looks like a
It's
turtle head.
It's
like a
gone.
Is it
It looks
retracted
like
in?
it looks like a vajayjay.
Oh,
And so,
Kinda.
it's a
It's like-
moose knuckle.
It's like
oh
in.
dear,
Oh,
it looks like a turtle head. It kind of
it's just so sad.
right.
Anyhow,
And-
but you were telling me about talking about butts. Tell me
Right.
about the strip club
oh, the
Oh,
strip
yes.
idea,
clubs. Yeah,
which
that's
I think is amazing. But
Yeah.
It's a good idea.
yes,
So, me and some of the girls in the office, we do a lot of tummy tucks, and we, obviously, I think we make these people look really amazing.
Yes.
But, there is a scar that's visible. And
Yeah.
we're thinking about, well, what happens when, let's say, you're a stripper,
Yes.
and you have a tummy tuck scar. What do you do? Well, I wanted to open up my own strip club called Stretchies.
That's perfect.
Where all women who have had C-sections, tummy tucks, and stretch marks come to Stretchies because we want the men who are really into that.
Do you think people would pay?
Husbands.
There's some kinky people. People
Yes.
are weird.
Yeah.
They would
Absolutely.
pay.
They would
If
for
they
sure
paid
pay.
you
always-
for feet, there are people that will pay to have stretch marks like all up in their
Stretchies.
grill. And
Okay,
Yeah.
we need. Sorry, people. It's trademarked. We're taking it.
Oh, jeez. I think even
I'll
with
run
the tummy
it.
tuck scar, they would still do it. I mean, you could. You can't hide it.
I always wonder that about I have a tummy tuck scar. That thing is big.
yeah,
Yes,
it's long.
It's long.
It
It's
is long.
long, and
it's noticeable.
like it's noticeable.
and if you came to Stretchies, we would be all
I'd be
nude, not
welcome.
topless. So
Okay.
it would be visible. We'd probably have people wear some makeup or something, just so it's not as in your face.
yeah,
it could be in
cover
your
it.
face. I mean, if
Well,
you're
after-
going to Stretchies,
after-
you want to see
you
the stretch
know-
marks and you want to see the
correct.
scars.
You know
Yeah.
what you're in for. I think that's awesome.
It's kind of cool. And then plus you give a venue for all these women who, I don't know, that
Live their
maybe
best
would
life.
feel better about themselves. Like, hey, well, she's got stretch marks and
Right.
she's got a
Yes.
tummy tuck. I feel
Yes.
I'm living my best life up
Yes.
here. And guys are paying. They all feel empowered.
know.
Right.
Right?
I
They're
feel like
paying
it would,
for their neck surgery.
Yeah.
it would bring in a ton of women. I feel like they'd be more confident.
Yeah.
I
Yes.
feel like it would.
Oh, you
If
mean
you ever
like
wanted to be
women
a-
who
Like
come in?
women go
You're
to strip
right.
clubs
You're
because
right.
I don't want to go to a strip club.
You don't
Because they
wanna
want
feel
to
bad about
see a
yourself.
woman who otherwise looks really great,
That they
but is
can
not
relate to.
afraid of showing these scars.
Right.
And I think that would make them they would feel better about themselves
Yes.
if they had stretch marks, loose skin, that these are real people. But
Agree.
they're making a great living.
Right.
Yeah.
And
Love
living,
it.
pretty
Yeah.
solid life. And I think it's great. Stretchies.
Stretchies. Done.
Stretchies.
Are copyrighted.
Stretchies.
What about like breast lift
Stretchies
and
by
breast
Dr.
dogs?
D.
Can they still be a part of it or no?
Absolutely.
Yeah,
Oh,
but
okay, they
breast
can?
dogs are like the incision
Well,
doesn't
breast
even count.
lifts.
Oh yeah,
Yeah,
lifts.
even
You
like
can see it.
reductions,
Yes.
because these
Anything like
scars
that.
are a little bit larger, and same thing with the bottom part.
Yeah.
We'd still call it stretchies.
Yeah,
on the
totally.
breast, would you have to rename the bar or something?
Arms.
No,
arms,
stretchies covers everything.
Covers everything.
Yeah, that's a
Yeah.
good
All
one.
of that.
Yeah, I think that'd be perfect.
All right.
Stretchies.
Love
Look
it.
into
Let's do it.
Amber.
I'll help you run
We
it.
got to start
I will help
investigating.
manage it too.
I think we just open up, a place called Stretchies. That's
And just
pretty
see.
easy. And then just say, we don't take all these, other
Sorry.
women. It's just
Sorry.
people.
You don't have a stretch mark, you can't join the
You
club.
don't
Yeah.
have a scar.
Yeah.
You can't be a part of us.
Go to the lodge or the Crazy Horse down the road. This is Stretchies.
And maybe we could do our podcast on the stage.
Right.
Because just because you don't have a tummy tuck scar doesn't mean there are beautiful women walking around
Yes.
with whatever. They've had kids, they've had stretch marks, and guys would pay for that stuff.
Yes.
Loose skin. all
Yeah.
that. Yeah. Absolutely.
Guys, you said pay for feet fetishes.
Totally.
What's the
Yeah,
big
there's
deal
some-
about a little bit of stretch marks?
Right.
Yeah. So
You know they can have kids, so trying to get them pregnant.
You can have stretch marks and not have kids.
True. That is true.
It's
Yeah.
so true.
That is true.
weight changes,
I had
weight
stretch
loss.
marks
Yeah.
when I was like 16 from
Yeah.
growing. Like,
Yeah.
Yeah.
That's-
like on your legs and stuff.
yeah,
or some-
totally.
I've seen some. I feel like we've seen some of our own post-op patients who have had lower body lifts.
Yes.
Who look really great.
Yes.
And even with underwear, they cover it all, and they look awesome.
Yeah,
Yeah.
totally.
And
You can't tell,
they could
really.
they'd definitely be a part of Stretchies. They'd
Yep.
be like the massive weight loss club.
We can have
Because they've
different
lost-
sections.
Yeah.
Yeah. Wherever
Different
you feel
stages.
like going.
On this stage, we have Cassidy, who had a brachioplasty and thigh lift only 2 years ago. Take a look at that.
And she's just showing it off. You
Right.
don't even have to do
I
anything.
love it.
And then you get some sort of like 80s, song behind it.
Yes.
Like shot
Like
to
a
the
work-
Bon Jovi.
Yes, love it.
I'm thinking like
Totally
a
do
workout
it.
song. She's just like, when she walks out,
What's that?
strutting it.
What's that one where all the water comes on that lady and she's sitting on flash dance?
Footloose? No, not Footloose.
Flash dance.
Flash dance. Yeah.
What was the song? The classic songs for
shit.
flash dance?
I don't know. But I know
She's
what
a
we're talking about.
maniac. Oh my gosh, Angelica doesn't know that.
Sorry.
So,
She's too young.
but so that's my idea for Stretchies. I'm ready to do it.
I
so
am totally
any
ready.
investors, let us know. Hit
Yes.
Angelica up.
Yeah. Let us know.
But that kind of brings us into the other topic that you brought up was revision surgeries.
Yeah.
Yeah.
I think that's a big topic.
Right.
We see a lot of people for revision surgery. Anytime you have surgery, there's always a possibility, and we put that in our consents. But yeah, we see some interesting things.
Yeah.
And when
I don't
you
know.
mean revisions, someone are patients and then people who've had surgery elsewhere.
Right,
And then
right.
need a revision too.
Yeah. And so sometimes it's really straightforward. They've had a tummy tuck.
Right.
And I see a lot of this. I see people who get tummy tucks but don't have a lot of liposuction, which I think was a very old school way of thinking, where plastic surgeons 20 years ago felt really great. Like, oh, I can remove all the skin. It looks good.
Correct.
But then the scars weren't typically like low enough.
Yeah.
No liposuction. So they just look like a brick wall, like something straight.
Very square.
And if you
no
look,
curves.
No curves.
No curves.
And
or the top part of your stomach when they don't liposuction that.
Yes. It's
like
and so it's like all bulgy.
Yeah. So I was trained that way too, right? When I came out of training, I had people who were older, and it was almost taboo to liposuction because of, you worry about hurting the blood supply on the upper part of the tummy. So you kind of left it full, very little liposuction of the sides. Now, I treat liposuction almost as big as, it takes me sometimes just as long to do the liposuction as it does to do the tummy tuck. And I turn them to different sides, whether it's lateral or posterior. Never did that in training. But, the whole tummy is like 360s, right? It's just not a two-dimensional page. So, when I do the tummy tucks, you think about all those things.
Yeah.
How do you keep the scar low? How do you keep from dog ears happening? I need to turn her around to really get the back. Because if your front looks good, but then you got like love handles.
Rolls in the back, not cute.
It's not good.
No.
So revision surgeries, you see a lot of that where they have all the skin removed and it's okay, but no liposuction.
Right.
And they are really unhappy still.
Do you feel like people get better results if they do multiple rounds of liposuction?
It depends. I think if you are someone whose BMI is over 30, we don't operate on in people over 30 because I do, believe that they have better results if they lose weight, and then I'm left to do more of the fine tuning and removal of skin. But 2 rounds, I think those would fall into people who are close to like 29, where they have a lot of fat. And you're taking a lot, so sometimes I hit a limit too, right?
Yeah.
You can only do so much in the surgery center that I have to stop at 5 liters. So, and I think that's safe. When I hear of like 8-10 liters, I really don't think that's safe. I will tell you, then it becomes more of like your chance of blood transfusion goes way up.
Yep.
Your chances of have a longer recovery, poor wound healing, all go up if you do way more.
Right.
So this idea of like, oh, I'm BMI of 40, which is your, how overweight you are. If it's really high, I tell everybody, liposuction is not a weight loss procedure.
Correct.
It's body contouring. So I think on a few occasions, I can take out more fat if someone's closer to their BMI of 30.
Right.
A second time, especially the upper abdomen, where then I can go really, really thin. I still do it the first time, but yes, I'd say about maybe 10% I would do twice.
Okay.
But if you come in and your weight, your BMI is like 24, 23, I'm able to get everything out that first time.
Yeah.
So I feel pretty good about that. But yeah, sometimes a third. I think that comes more importantly with fat transfers.
Yes.
How about
that's important.
someone comes, they get a BBL, and they're happy, but they want to be bigger, right? I always tell people sometimes it takes 2 rounds of liposuction because maybe the limit isn't how much you can take out. The limit is how much your butt can accept.
Correct.
Right? You can't just jam 5 liters of fat into someone's butt. So much is going to be reabsorbed. So it's the recipient capacitance, as we call it. How much can it take? Because once it gets too tight and that fat's like squirting back at you through the little holes, you're done. You can't put any more.
Well, all these Instagram models that are super, super tiny with these big old butts, they're doing like 2 or 3 BBLs.
Right.
Yes,
There's no way it's just one and done.
And
or
some
a
of
big
the
implant.
And some of the honest ones
but they're
will
also
tell
doing
you.
the fat transfer to like their hips.
Yes, for sure.
And I think the honest ones will tell you that they have it done twice.
Yes.
Yeah.
Most of them will say they've had something done.
Yeah.
But they won't tell you like the degree.
Yeah.
I know plenty of people who come here to have like a second round of liposuction. They've had it maybe once, twice. And they come to me and I'm just maybe the third person who's done it. So it definitely happens much more than some of the people would let them, be truthful about it on Instagram.
Yeah.
But it happens a lot more. Doing
some
2
of
or
those
3.
girls are so tiny with big old butts.
Yeah.
They are. Or the whole rib removal type thing.
What?
The
Rib removal?
Oh, yeah.
Makes their waist even, or their whole like upper body super tiny.
Yeah.
I want to do that.
Oh.
I think that's a cool procedure, honestly.
Yeah. Ooh, you want to try it on me?
Well, I think I'd want to see.
Wow.
I'll be your guinea pig.
Yeah. It's not, you have to be careful. You have to know what you're doing because you're by the ribs, which are by the lungs, which are by the heart. And,
Okay,
but,
never mind.
if you do it safely, it's pretty
Let 'em
easy.
try. I'm trying on you.
You still have to, you put a scar on someone's, thorax, so it's not invisible.
You can't go through like a tummy tuck scar?
No, not that I know of. Maybe there is a way to do it that someone's, but I've never.
Those girls that do it with the rib removal, I never see them having scars on their side.
They're there. They're there, but
good old Photoshop,
right? Yeah. That's probably what it is. If you look at any Instagrammer, their Instagram is so photoshopped, so face-tuned, auto-tuned. They have got all these different filters on to make them look like the perfect human.
Crazy.
It is.
Yeah. Yeah. So I think those Instagram models, they may have had tummy tucks. You never know because they just edit that stuff out. And if there's irregularities, even from their buttock transfers or fat transfers, they can smooth that out.
It.
Yeah. So when you see these, and the way they take the picture.
Stretchies, they would be welcome.
Right.
Yes, they would.
And when you take a picture, you bend a little bit.
Yes.
So you put tension on the skin. And you can make your butt, I can make my booty stick out if I push it out. So you get the right angle and the skin looks smoother because you're stretching it. Right? I could take a picture of any one of us in here and we're sitting down but slouching.
Yes.
We're all going to have loose folded skin.
Yeah.
Even with, let's say, Angelica, who works out a lot, hasn't had children.
She has
you're
no
going to have loose
skin.
If you go like,
if I sit, I got some right now. Oh, I do. Right? And it's probably the angles that you wouldn't.
But if I were to lay you on the operating room table,
I would look so skinny.
Everybody looks tight.
Right, they look
so
tiny.
Be careful when you look at some of these pictures, afterwards, that they're all laying flat. And if you notice, their arms are pulled up, so their breast skin looks tight.
Yes.
So there's a lot of things, just knowing being on the other side.
That movie, what is it? The Sweetest Things, and she's like 40.
Right.
28, 40. And she lifts her arms up, and her boobs are all nice and perky.
Yeah. You can give yourself a breast lift just by lifting up your arms and taking a picture.
Yes.
Yeah.
Yep. It is. It's all about your angles and what you do. So.
Right. So, I don't know. I think there should be some truth in some advertising, when you're saying that you've had some sort of procedure. I mean, I think if you did, let people know. And, if... look at someone carefully if they're just doing one angle all the time on their butt, certain side profile. But if you looked at them straight on, you would see it all, maybe not as perfect as it looks like.
Yeah.
Well, revisions, what do you feel like, what's the craziest revision surgery?
So the craziest, I'm trying to think.
That someone's come in and had this nuts surgery and they want you to revise it.
Yeah. Well, I think if it's really crazy, I probably don't do it.
Yeah, you wouldn't do it.
I'm trying to think. Anybody who wants me to make them look like somebody, whether it's their breast or their tummy, since we're not doing a lot of noses or anything, no one comes in and says, I want to look like Angelina Jolie. But if they say, I need to look like...
Kylie Jenner's a big one.
Kylie Jenner, right?
She's had work done, though. We were literally just talking about it before the podcast.
Yeah.
Right. And, Kylie Jenner or Nicki Minaj, but then they come in and say, well, I've had liposuction done. I recently lost 50 pounds. I don't want any scars. And you see them and their skin looks all ripply from all the previous liposuction because someone told them, I'm going to lipo you and that's going to make all your skin tight. And it didn't.
Right.
And now they have all these like irregularities because that happens to loose skin. You don't have any tension to kind of smooth things out. And then they don't want you to do like, well, you need a tummy tuck scar. No, I don't want a tummy tuck scar. Yeah. I have to tell them, listen, you're like very difficult. This isn't like plastic surgery 101. It's like advanced surgery, master's degree. And I wouldn't go to anybody who hasn't had any experience. And then if I go in there and say, oh, I'm going to liposuction it again, I'll make the liposuction work. No, because then I'm not telling the truth. So I'll just tell them, you need the tummy tuck. That's the only way I can put tension and straighten out all the irregularities. I need to redo the liposuction. And I might not be able to get all the irregularities better, but I can make it better.
Yeah.
And if I get the sense that they're like, better is not good, I need perfect, then I say I can't do it.
Yeah. You can't operate,
So I wouldn't say it's crazy, but taking on very difficult cases. And once you put a knife on someone and you make scars and you liposuction, there's an inherent change in everything, blood supply, scar tissue. And so you've already made a surgery that, the first time around was a little bit easier. Now it's, exponentially harder. So if you are wanting a revision surgery, make sure you go to someone who's doing this a lot.
Yes.
Right.
Even breast, that's where we see a lot of revision stuff where, I would say the people who have capsular contractures, all that hard tissue, and they had a lift that didn't quite heal right. So you have really big scars, those anchor scars. I mean, that takes, first someone with experience, but then sometimes thinking out of the box, too. Yeah. Do you take out the implant, fat graft? Do you stage it? Do you just revise the scars? Mm-hmm. Be careful with the nipple because it's been cut.
Yes.
So if they had wound healing so these are all things you have to think about. Nowadays, I have a good feel for, what I can and can't do. But someone who's new, they can get into trouble trying to, especially if a woman's pushing you. I want 800 cc's, right?
Which is a big
and I'm an A cup, and I had a breast lift.
Yeah, no.
And I want to revision my scars. I want to go up 3 cup sizes. And you're like, whoa, wait, I need to first maybe fix the scars. I need to fix the contours with fat grafting. Then we come back and add the larger implant.
Right.
Yep.
You have to kind of back people down a little bit. I don't know. What do you think? I mean,
yeah.
It's tough because people want everything in one surgery.
Correct, and they don't understand that you need multiple sometimes.
I don't want to do multiple surgeries on someone, but if I think that's the best thing and I think it's the safest, I definitely tell them. Or if they're not willing to,
have a scar,
but I really think they need it, and I don't think I can give them that result.
Yes.
And I will tell them that I don't think anybody could take liposuction and make your stretch marks better or go away. I'll tell them that. And because we see people on the other side of it.
Yes.
Some surgeons said, oh yeah, I can make your rectus diastasis look better. I can make it look better by liposuction. And they really needed the tummy tuck, and they're very, very disappointed. And now it's easier to convince them about the tummy tuck because now they go, oh, maybe they were right.
That's what we need.
But they lost trust in that other surgeon because they feel like, well, even though they pushed him, they felt like the surgeon should have told them, hey, we can't do this. So I won't do a surgery if I really, really think they need it, because then I know I can't give them the results that they want.
Yeah.
So that's the whole beauty and art of a consultation, to be able to tell, what I can do and can't do.
Yeah.
And if this person has realistic expectations.
Right.
Yeah. So it's the art of plastic surgery. It is like being in a psychiatry office.
It is.
Yeah.
100%.
I mean,
and then you're dealing with their spouses, their family dynamics.
Yes,
it's a lot.
Husbands who don't want them to have any surgery or don't want them to have a breast reduction when they clearly have back pain.
Yep.
We had someone today who she had a very nice result from implants. Just a C cup, looks great. But she didn't want them anymore. She's a runner, and the husband was like, "No, I like them. I don't want it." So now they're talking to each other. Well, I'm like, "You want them out? Well, that's easy enough. I could do that." Yeah. But then they're having a separate discussion. I'm like, you guys need to, make sure you come together.
About it together. Be on the same page.
I'd rather, because I don't want to do a surgery when the wife wants it, but the husband is not supportive of it. Yeah, because guess who? She has to go home to, and that person takes care of that person.
It's your husband.
And
support.
They're miserable, even though they're happy because they got the surgery that they wanted. If the significant other isn't all on board, it's tough.
It sucks. Yeah.
Yeah. So I don't know. You had your surgery, and you had your significant other at the time there a little bit, right? But you had your mom.
Yeah, you had your mom.
My mom was the greatest support
dads,
system.
They're the best.
Husbands. I was a nightmare as a patient.
Yeah. But some people like you have unexpected pain, meaning it's a lot more than you envisioned.
Totally.
And so it was just like a sort of an emotional, you had to almost like recalibrate yourself to be like, I'm completely not myself.
Yeah,
for this
it's
time.
freaking sucked.
Yeah.
But I also didn't tell Sean all I was doing.
He was probably like miserable.
So I came home
mind.
and he's like, "What the hell are those balls hanging from you? The bloody dreams."
Oh, right. Yeah.
Yeah.
And that's a pretty simple thing that you would think that they would know beforehand.
Wait, what did you tell him that you did? Or you were going to
I didn't tell him that I was doing lipo to my whole body. And I told him my recovery was only going to be like a day or two.
Oh my gosh. Poor Sean.
What about a guy?
My next surgery, because I want to go back. Yeah. And he's like, okay, whatever. Like now he's like, cool. He's not fazed by it.
But you've been through the hardest. So I think whatever you come back for will be much, much easier.
Yeah, I was very emotional though.
Yeah.
You know me. I'm very...
Dang.
I'm thinking about a guy who comes in for penis surgery.
Yes.
And then has to... Because what if he ends up being a really difficult... has a lot of pain. The wife has to be on board.
The wife has to take care of it.
Yeah.
And I always feel like guys are worse.
Yeah.
Oh my gosh, little babies.
Especially when you're sick or anything. I mean, you were tough this past week, but 98% I think of guys usually like if it's a flu.
I was a weenie at home though.
You were?
I came and laid down. And I was like, Dr. Rejuvenation, can you
jeez.
rub my feet for me a little bit?
Did she rub them?
No.
She's like, she kind of just rubs it a little bit, like 2 fingers. You're good. And I'm like, no, really get into it and knead it. And so I didn't get that. But, if I asked for water or something, or, can I get a Tylenol? She was good. So I tried to play it up a little bit.
Yeah.
But, my gosh, you would be that. But it's not as bad.
Like London will like, Daddy, do you want something to drink? Daddy, do you want a head rub? What do you want, Daddy? You want some snacks?
I wish.
Like she's like a little mini housekeeper at home.
Yeah.
My dad was like, all right, you want $5? Go clean the house. I need a back rub. I need this, that. And I'm like, oh, jeez, okay.
But when he got sick, was he a big baby? Or was he just like, no big deal?
No,
he's not. No, my dad was never like that. He was pretty good. If he had a cold or like the flu or anything,
he'd power through,
hammering on his computer like, what do you want, Angelica? I know that's why you're here.
So what if you're sick? When you were smaller,
if I was sick and my dad was watching us, if we like got sick, like let's say we threw up in the bathroom, he would just shut the door and tell my mom to clean up. And I'm so serious. He was terrified of us when we were sick. He would go up to his office. And we'd be passed out on the couch, and he'd come down, check our fever, give us a Tylenol, and be like, "All right, your mom will be home soon." Like that was it. Just keep watching TV.
I have this distinct memory when I was younger. I was like, I must have been 6, but I was really constipated.
Okay.
And, sometimes kids do that because they don't drink enough.
Correct.
So I think that's what happened with me. And then I had to have like a suppository.
No.
And I remember like my
Your
mom had to give it. And it was just the worst experience.
You know what's so funny is I do remember that.
Because it was
when
so
I had to do it. Yes. And I remember I was on my mom had a pink like velvet chair that I had to sit on. That's so funny. I had that. Remember when I was little?
Yeah.
Okay, I never had that, so
you never were constipated.
You were never constipated.
You were constipated when you had your surgery.
Yes, when I had my surgery, I was
but you didn't need a suppository.
You didn't
no,
need one?
I did not need that. No, I thankfully like a week later, I drank an entire bottle of milk magnesia, finished like Miralax, all that stuff, nothing, and I was like, and I have a great. I mean, I not to be like graphic, but I use the bathroom pretty often. Like,
are you a daily?
Daily, yeah.
Pooper? Okay.
Yeah, of course.
No, that's normal.
Oh, see, yeah.
Some people
I don't know about you because you're secretive.
If you go beyond every 3 days,
I don't like talking about poops.
Yeah.
No, I know, but
it's okay.
But
if you go beyond 3 days, is that bad?
Yeah, they say that's when you should really maybe think about adding some fiber or something.
Oh, for real?
Yeah, because if you're going like more, if you're waiting more than 3 days,
you start eating fiber 1 over there.
Yeah. Because they say pretty normal is like once a day or once every 2 days. But if you're going beyond 3 days,
that's not good.
Maybe you should be adding some fiber.
Some backup.
I'll never forget. You probably
You're getting
don't
backed up
this.
there.
I know. 3 days. I'm like, 3 days.
I can only imagine. So, if you're a daily person, it's more smaller. When you're a 3-day person, it's got to be like a freaking drop in a payload, like where.
So gross.
Yeah, I think of a big dump truck.
Right.
Beep, 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 boom. And a huge splash coming out.
God,
it's probably like a rock because it's so hard.
Ours are like smart bombs because they're just.
Can we not talk about
poop? Well,
I do remember. You probably don't remember this. Years ago, we had a patient who called, and she was so like constipated. You had to walk the patient's husband over the phone step by step on how to do it, and like the
manual disimpaction.
No, or
plates.
Yes.
Oh,
and the wife was like screaming, and the husband was like, "No, no!" And I remember you just being so calm, trying to walk him through it.
Yeah,
it was like mortifying.
And so that's why it's important you take your stool softener.
Yes.
Sometimes the stool softener doesn't work, so people have to do milk of magnesia or Miralax.
Yeah, and that didn't even really work for me yet.
Yeah, and the pain medication gets you all constipated.
So once I stopped taking it, I was good. I was great. I was good to go.
I don't even care about pooping. I just care about if I'm like crying and all emotional after surgery.
Yeah, I was good.
Not pooping doesn't even faze me.
You know what's the number one thing that makes people feel the worst after surgery? That if they could just take that one thing away, they would pay like $1,000 for it.
What?
Nausea. If you're vomiting right after surgery, if you've
nauseous.
had it, all those people go, the pain didn't bother me.
Yeah.
You
Really?
know, all my lipo, it was the nausea. If you could, they would pay $1,000 to not have nausea after surgery. That was the most uncomfortable thing. And studies have shown that you have a better recovery if you're not having post-op nausea. So it's really important that we cover for that.
Yeah.
But people who have a really extreme, version to it, there are pills that you can take the day before or day of surgery, and it's really very effective. Otherwise, you're kind of always treating it after the fact.
Yes.
So they're nauseated, but you give them something, so it helps them a little bit.
Yeah.
It's a terrible, terrible feeling, to be nauseated. And then if you had a tummy tuck and you know how you retch and your muscles
so
tighten?
tight. No,
especially if
that's
you
the
just had the
worst.
rectus diastasis.
Yeah.
Too.
It could
After
be
a tummy
awful.
tuck, when you cough or you're laughing, it hurts so bad.
I can't even imagine.
So we do our best to really pre-treat these people.
Yeah.
But if they really have a bad reaction, there's a pill that we can give people, and it's great.
Dang.
I would take it. I never had a post-op reaction, but
Yeah, I mean,
Were you nauseous?
Yeah, I was.
You
a little
were?
bit, not bad, but if I got up and walked around for if I walked from here to the end of the door, which is only 5 feet. First 3 days, super nauseous. We went to Target, my mom and I literally was dying on a bench. So
Crazy.
it's anybody who's thrown up. You don't have to have surgery, but if you've thrown up, it's bad. Have you ever seen that Seinfeld?
No.
Where he was like, he was feeling sick, but he's like, I haven't thrown up since 1981, and I'm not going to do it today. He's trying to hold it in, and finally he threw up. But some people can force themselves not to.
How?
What?
I don't know.
I don't know how that works.
They have a good control of their retching system.
Gross.
But
No, gay.
Yeah.
Can't say that. Can't say
but
that.
I mean, anybody who's a really good drinker and gets wasted, or what's the word for it these
Hammered,
days?
shit-faced.
Shit-faced.
Blacked out.
How they could force
Rowdy
themselves to throw up.
lit.
Sean's like that.
Oh, he does
My
that when
husband,
he's drunk?
totally.
Ooh.
He can force himself to throw up if he's drank too much. I can't.
I mean, I can.
Oh, you can?
Yeah,
I can't
absolutely.
at all.
But I mean,
Do you? Do you put your finger down your throat?
no.
She'll throw up and she's like, shot.
Yes. That
She'll
used
keep
to be
going.
me.
It's like the
But
boot and
now,
rally.
Back in college, it used to be the night of. I used to get home, or I used to go to the bathroom really quick, throw up, be completely fine. Now it's the next morning, and I'm like, dying, sitting there on my toilet, so.
See, I will never throw up from a hangover. I feel like I'm dry heaving, but I don't ever throw up.
See, it's and it's usually I feel like stomach acid or something like that at that point.
I don't know.
I
think
have
it's
heartburn though, so I
'cause it
take
hurts.
heartburn medication.
Before you
daily.
go to bed after you're hammered?
No, every day. I just have worse heartburn.
Yeah. I mean,
don't know.
I think it's a chemical thing. Your body senses that
Right.
there's just too much of this bad stuff,
Booze.
and it just forces you to retch. But
Right.
unfortunately, alcohol passes through the stomach so quickly, it's not like you can retch and save yourself from being drunk. You just
Does
do
it help you though? Not be as hungover the next day?
I don't think so, because that alcohol has already been through your system.
Sean really
so-
says, I feel so much better now.
I feel no, it does. And I feel like it's all the sugar. It depends on what you drink. If I drink cranberry,
See,
or
I'm a
sugary
champagne
drinks,
drinker.
so I feel like every
It's all
time
sugar.
I
it's
thought it was
all
tequila.
sugar. I'm a tequila
Tequila?
person.
Or-
Tequila soda. I'm good.
What are those
Champagne.
really nasty shots? Taste
Fireball?
like licorice.
Rumplemans.
Jägermeister.
Or Jaeger.
That made everybody
Jaeger's
throw
gross.
up.
Yeah, of
I was
course.
never a
I feel like
Jaeger.
throwing up right when you drink it.
Yeah,
It
I
tastes
can't
so
even
bad.
smell it. Fireball makes me sick too.
I like
That's
Fireball.
disgusting. The only one I'm good with is tequila shots. I won't do any other shots really. Everything else is sugary or tastes awful, or you try and swallow and it comes right back and you're
Yeah.
What's your drink of choice?
a tequila soda with lime, or tequila with a splash of pineapple maybe sometimes, but it depends. It's typically tequila soda with
I've
two
never had
limes.
never had
tequila
that.
with soda.
So usually people do vodka soda. It's super, or vodka water, tequila soda, tequila water.
I think I've really only had vodka shots.
Yes, and
Yeah,
no.
what's your drink when you go out? Because
Probably
you
just vodka, something with vodka.
Really?
Yeah, the
Cranberry?
clear. I think the clearness of it is
see,
better.
I like
for
the
me.
clear stuff too.
Yeah,
But
Well,
my
yeah,
drink
but-
is champagne.
tequila is clear.
or Crown and Coke.
Yeah,
I do
you
like.
like Crown
You're
and Coke.
into Crown and Coke.
For
Like
We
some
know
reason.
you
You know
like-
why? It's because when I was in college, that's what we pre-gamed with,
Oh,
right?
wow.
Before you had to go to the club,
Yeah.
we went and got Captain and Coke because it was pretty cheap.
Oh yeah.
And
but now you're drinking
what's
the
good?
Crown Apple.
Yeah, I've
you like
upgraded
the-
in the world. Not
Yeah,
Captain and
you're
Coke,
fancy now.
Crown and Coke.
Hey,
Woo,
Captain
woo.
was like the luxury
Black
in
Label.
college. I used to go and get this stuff called KG, and that was Kentucky Gentleman, and it was like literally $6 for like a big bottle.
Oh.
And we would drink that, and you would mix it with apple cider, and it was
Gross.
so good. Oh no, it was good. I mean,
It
but
sounds
it's
like
all sugar.
after you would feel terrible.
And you know it's shitty because of how cheap it was, and you felt shitty after, but it is cheap. But it got the job done.
Was
let
there
me
a
tell
shitty
you.
beer of choice that you guys had?
Yeah, Natty
Paps.
Light.
Paps?
I
Yeah, I
love
remember that.
Paps.
Pabst Blue
Natty
Ribbon.
Lights.
Paps is
Nat-
like popular
Keystone
now, though.
Light.
Keystone.
Bud Lights,
In
cheap
college,
Coors
there was
Light.
a lot of Keystone Lights
Yes.
going around.
What
No,
else
I
was
never
there?
drank that.
Pabst Blue Ribbon.
Pabst-
Yes.
Milwaukee, the
Milwaukee.
Beast.
Yes.
We call it the Beast.
Milwaukee's
Milwaukee's
best. We had
that
even
was cheap.
Chicago's beer.
See,
Old
we used to
style
drink
is super
wine
cheap.
coolers.
No,
What's that,
we did
light
not
coolers?
drink those.
Wine coolers.
Zima. Remember
Boone's
Zima?
Farm.
Now you
Montezuma. Did you say Montezuma?
Oh, no,
never mind.
Zima.
Okay, I was like, that's the
But now
cheap
we drink
tequila that I
Truly.
drink.
Now we
White
have
Claws
Trulies.
and
We have
Truly.
White Claws.
I've never had a White Claw.
There's Monaco 69, and it's so good. It's better than White Claw and Truly.
Really?
Yes, it's like my favorite. I don't know if you can find it out here though. I haven't really looked.
Well, let's get that
In
for next
Chicago they do.
podcast.
I will do my best.
All right.
All right, guys.
Cool.
Well,
Well, gosh, that's a lot
We
left
went
over
on.
for
We went
us
over
to talk about
booty
next time.
injections. We went over what
How often you should poop.
right drinks. We went over revision surgeries.
Revision surgeries.
That's
I
big.
like personally talking about poops. I
know,
think that is something.
It's like your favorite
Poops,
topic.
farts,
Stretchies.
stretchies.
Stretchies is my new thing.
Stretchies
Yeah.
is like
Like, I'm
everybody better
game.
sign up. If you had surgery with us, you better come show off your body.
Yes.
Yeah.
Yeah.
Because I think our women look amazing.
Yes.
Yes.
And maybe we will do like just topless.
Why?
No.
Nude? Okay.
It depends on if you can have a choice. You don't have to do the whole full
Yeah.
nude if you don't want to. Nobody's going to force you to
Yeah.
do that.
What's Texas laws? Like, are the strip clubs here full nude?
I don't know.
I've never been.
I don't know.
Not to.
I don't believe
The
that.
last that I remember, it's not like I visit, strip clubs. I think the last must have been years ago at a bachelor party. But I think if it's all nude, you
can't drink.
You can't sell liquor there. And
But is it BYOB? Because Texas, I'm
Yes,
from California,
yeah,
so
BYOB.
California, it's not like that.
BYOB if it's totally nude, and then if it's topless, I think which most places are, then you can sell alcohol.
Oh.
Okay, well, if you do topless, but then you can't show off your stretch marks.
Yeah.
I mean,
defeats
unless
the
they wear
purpose.
like
They're
tiny
usually
little
wearing
underwear
thongs or something like
okay,
that.
so I
Yeah,
guess
they're
that's
taking
fine.
that off, though.
They
Oh,
can keep
on
them
the-
on if it's topless. They can keep little tiny underwear thongs on, and
Maybe
you
we
show
should
off your
go
scar.
and do some investigation.
That's
Yeah.
what we're gonna have to do for next time.
Okay.
Oh, my God, yes.
I have to
All
get
right.
permission from the
Oh, yeah.
boss,
Well,
It
I'm
might-
sure you don't have to
It
get
might just be
permission.
you two.
IBS. We'll take
So,
Dr. Rejuvenation
Can you
with
take
us.
pictures?
No.
You can't. I don't even think. Can you bring
I
your
don't
phone?
think
But
you
you
can bring
can't
your
take
phone,
it.
yeah.
Oh,
Like,
I'd
you
have
can't
to.
be Snapchatting when
we'll
you're
just
there.
give you what
Someone's
we
got to
see.
get married, and I got to go on a bachelor party, and that's
Yes.
usually when it's a code
Yeah.
green. Otherwise, it's a code red.
I think it's gonna be code red, but we
I
might be
think
able to
if
steal
you
Dr.
go-
Rejuvenation.
Yeah,
take her
I
with
think
us.
I don't go get married just because we need to go
No,
to
right,
that.
we need
I think
this.
strip clubs are okay if you go with your partner.
Yeah,
like if you
yeah,
go
sure.
together.
So it's gonna be me, you, and Sean.
You can bring
Authors
your
together.
significant other.
Yes.
I mean, if he wants to go,
I'm
but
sure
he's,
he-
I'm sure he'll want to
Yeah.
go.
Oh,
If
you
you
wanna
ever tell
go?
a guy,
Yeah.
they're not gonna be like, no, honey, I don't feel like
baby,
going
I
to a
got
strip
you.
club.
He might
tonight."
because you guys are still in that honeymoon phase. We're like, no, baby,
Nah,
I got
no.
you.
He'll want to go.
She'll be like,
Yeah.
let's go.
And then
How
we
much is it
know.
gonna cost
Yeah, if he
me?
doesn't want to go, then we know he's full of shit.
Yes.
Right.
All right, guys. So thanks for joining us for another episode of Dr. Dallas Unleashed. Thank you, Angelica. Thank you,
you.
Amber.
Yes.
Till next time. We're taking Thanksgiving off. Happy Thanksgiving to
Yes,
everybody.
guys.
We're thankful for everybody.
We are thankful for just being on this planet, living our best life.
Amen.
We could be
Right.
out there doing a job like cleaning the bathrooms at 7-Eleven, but we're
True.
here doing this.
How
and
grateful. I'm very
entertaining and
thankful.
having a good time.
Yeah.
So thank you, everybody, for joining
Thank
us,
you.
listening to us. Tell your friends about us. You can find us, Angelica.
Let's see, Apple Podcasts, Google Play, Spotify, iTunes, pretty much anywhere you can find a podcast.
YouTube.
There you
YouTube,
go.
our social media. So make
Check
sure you
us
follow
out.
us. Swipe up.
At Real Dr. Dallas.
Yes.
That's the
Instagram,
handle.
Snapchat.
Yes.
Awesome. Thanks,
All right.
guys.
Peace out. Thanks, guys.
Bye.
Bye.